America's public health system is undergoing, well, nothing short of a seismic shift. There's a new vision for health now taking the reins at the Centers for Disease Control and Prevention. Many of you might be asking, what happens if America's leading health agency gets so tangled up in bureaucracy, maybe even political agendas, that it loses sight of its core mission? Well, just this week, we saw a pretty dramatic turning point. On August 28th, CDC Director Susan Monarez was fired, and in her place, Jim O'Neill, who's a top deputy to HHS Secretary Robert F. Kennedy Jr., was immediately tapped as acting director. Now, this isn't just swapping out personnel. It signals a really fundamental reorientation, and it's driven by this powerful agenda aiming to make America healthy again. So today, in this deep dive, we're going to unpack the sharp criticisms that fueled this pretty radical shift and explore the bold reforms now shaping our nation's health landscape.
Indeed. You're looking at a truly pivotal moment for public health in America. What's crucial to understand here is how decades of perceived mission creep, where the agency's focus expanded beyond its original purpose, how that, combined with some significant communication failures, have culminated in this administration's really decisive actions. Critics argue the CDC strayed pretty far from its origins. It expanded into areas like, well, environmental justice and health equity, while its fundamental job, protecting us from infectious diseases, seemed to weaken. So this move, installing new leadership, it reflects a very clear intent to refocus the agency on what many believe should be its primary function: detecting, controlling, combating, and preventing communicable diseases.
Okay, let's unpack this a bit. Before we really delve into the new direction, we need to understand the urgent calls for reform. What were the core criticisms against the CDC that got us here?
Well, the critical takeaway here is that while, challenges at the CDC aren't entirely new, they definitely intensified dramatically during the COVID-19 pandemic. A major issue was transparency and communication. The CDC was heavily criticized for not providing clear, unbiased health guidance and also for inconsistent messaging. This led to widespread public confusion and, frankly, it eroded trust quite a bit. Senator Rand Paul, for instance, stated pretty bluntly that the CDC operated with no oversight and that bureaucrats overstep authority, expanding their powers well beyond their mandate, in his view.
Right, so a perceived lack of clarity and also this idea of extending power. Can you give us some specific examples of this alleged overreach, things that really stood out?
Absolutely. The agency was accused of overstepping its statutory authorities in several key instances. Think back to February 2020, right at the very start of COVID-19. The CDC circulated a faulty test and then insisted on its sole use for a crucial month, even though more reliable options were apparently available internationally. That alone really hampered the early response.
Wow, okay. That's significant.
Yeah. And later, they enacted a scientifically and legally dubious nationwide eviction moratorium, which the courts eventually overturned. And they maintained questionable testing and masking requirements for travelers long after many argued they'd lost their scientific validity. Even a former CDC director, Rochelle Walensky, admitted the agency failed to reliably meet expectations during COVID-19. She cited dramatic, pretty public mistakes.
Those examples certainly paint a picture, don't they? An agency maybe not just struggling, but also venturing into areas many felt weren't its place. Which brings us to that key concept critics often cite, mission creep. What exactly does that mean in the context of the CDC? How did it supposedly expand beyond its original purpose?
That's an important distinction. Mission creep for the CDC, as defined by conservative groups like the Heritage Foundation and the Competitive Enterprise Institute, prominent think tanks, essentially means the agency strayed far from its origins. It started as the Communicable Disease Center, right? Focused purely on infectious diseases. But its $15 billion budget and 15,000 employees were seen as stretched across what these critics called far-flung and fashionable concerns, things like environmental justice and health equity.
Okay.
The insight here, from their perspective, is that these expanded priorities distracted the agency from its core mission of protecting the nation from infectious diseases. They point to the substandard response to the monkeypox outbreak as a direct consequence of this perceived distraction, suggesting resources were maybe misallocated.
Now, while some critics definitely see these expanded areas as mission creep, aren't there also arguments that these broader social and environmental factors are actually integral to a comprehensive public health strategy, even if they expand that traditional mandate?
That's an excellent point, and it really highlights the differing philosophies at play here. Many in the public health community would argue that issues like environmental factors, health equity, they do profoundly impact population health, especially for vulnerable communities. And therefore, They'd say these fall within a modern sort of holistic public health scope.
Mm-hmm.
However, the current administration and its supporters seem to advocate for a much narrower, more focused role for the CDC. They believe that trying to address too many issues at once just dilutes its effectiveness in its primary infectious disease mandate. That's where the core disagreement really lies.
That makes sense. It clarifies the tension. And beyond mission creep, there was that serious accusation of the politicization of science. What does that truly imply?
This is a serious accusation, and it isn't just about policy disagreement. It implies that scientific evidence or recommendations were perhaps manipulated or chosen to align with political agendas rather than purely objective findings. Critics argued, for example, that the CDC's school closure guidance and COVID-19 vaccine recommendations, especially for children, were politicized. And they contended these recommendations were incompatible with emerging data and maybe risk-benefit analyses at the time.
Right.
Senator Ron Johnson noted that the pandemic opened millions of eyes to the corruption of science and the corporate capture of federal health agencies. He emphasized what he believes is the need to restore integrity to science. End of quote. The real insight here is that this perception, whether accurate or not, of politicized science has profoundly damaged public trust in institutions that are supposed to be purely evidence-driven.
So, with these really deep-seated criticisms laid bare, you might be asking, okay, what happens next? This is where the Make America Healthy Again movement, or MAHA, led by HHS Secretary Robert F. Kennedy Jr., truly steps into the spotlight with a very bold agenda. Can you walk us through the vision and these dramatic recent leadership changes?
Right. So the MAHA movement operates under the premise that the U.S. is facing a chronic illness epidemic. They advocate for healthier lifestyle choices and a pretty direct confrontation with what they see as corruption in the food and pharmaceutical industries. And this vision is now driving significant changes at the CDC. The most immediate and I think striking change was the ousting of CDC Director Susan Monarez on August 28, 2025.
Just weeks into the job, right?
Exactly. Fired just weeks into her role. The stated reason was for not being aligned with the president's agenda of making America healthy again. And also, reportedly, for refusing to rubber stamp unscientific, reckless directives and fire dedicated health experts. The insight here is pretty clear. Her removal sends an unequivocal message that the administration demands total alignment with its health agenda.
That's a very clear directive from the top. And who has replaced her? What's her background?
Jim O'Neill. He was Deputy Secretary of HHS and is known as a close aide to RFK Jr. He was immediately tapped as acting CDC Director. Now, it's important to note, O'Neill has no medical or infectious disease training. His background was as a biotech investor and a former speechwriter.
No medical background at all.
None reported. His appointment is widely expected to bolster Kennedy's goals of remaking federal vaccine policy. During COVID-19, he publicly supported unproven treatments like ivermectin and hydroxychloroquine, and also shared what have been described as conspiratorial theories on social media. So the insight here is that his non-medical background clearly signals a shift towards perhaps policy-driven leadership rather than traditional scientific or medical expertise at the helm of the CDC.
That's a significant departure from typical CDC leadership, certainly. And how has the agency itself reacted? These must be quite the shockwaves internally.
Oh, absolutely. In reaction to Monarez's removal, 3 other senior CDC officials resigned almost immediately. This included the deputy director and heads of key centers. One of them, Dr. Dimitri Deskalakis, explicitly stated he could not serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality. The insight here is profound. This isn't just a loss of numbers. It's a significant depletion of institutional knowledge and scientific expertise. It definitely raises critical questions about how the CDC will maintain scientific rigor and effectively respond to future complex health threats.
Beyond the personnel changes, what specific policy changes have we actually seen already, especially concerning vaccines, which seem to be a central focus of this MAHA agenda?
Yes. Under Kennedy's leadership at HHS, we've already seen significant shifts. For example, back in May 2025, the CDC stopped recommending the COVID-19 vaccine for children and pregnant women.
Okay.
Then in June, Kennedy took the really drastic step of firing all 17 members of the CDC's Advisory Committee on Immunization Practices, known as ACIP.
That's the main vaccine advisory panel, isn't it?
That's right. It's the key panel responsible for official vaccine recommendations in the U.S. He fired them all and appointed several prominent anti-vaccine activists in their place. Senator Bill Cassidy has since called for ACIP's scheduled September meeting to be indefinitely postponed due to what he termed the turmoil. and a perceived lack of legitimacy with the new panel. The insight, again, is that these actions profoundly reshaped federal vaccine policy and, well, they cast a shadow over public trust in official vaccine guidance.
This really sounds like a comprehensive reevaluation of public health guidance across the board. What about the MAHA Commission itself? What kinds of claims and reports has it been putting out?
Well, the MAHA Commission, which is chaired by Kennedy, released a report back in May 2025. It focused on poor diet, environmental chemicals, lack of physical activity and stress, and over-medicalization as the primary causes of children's health problems. However, this report quickly drew criticism, particularly from the Democratic National Committee, the DNC. They accused it of fabricating sources and including medical misinformation, sometimes even attributed to AI use.
Fabricating sources, that's a serious charge.
Very serious. Kennedy has also publicly linked autism to vaccines, a claim widely debunked by major scientific studies. And a draft MAHA report even questioned the safety of water fluoridation and Wi-Fi 5G technology. So the insight here is that these controversial claims and the accusations about sources raise serious concerns about the evidentiary basis for future public health policies, and of course the potential for further erosion of public trust in established science.
So, given all these dramatic shifts, leadership, policy, the Commission's report, the biggest question now is, what does this actually mean for the CDC's long-term future and for public health in America? Beyond the leadership changes, there's this push for significant structural and policy reforms we've touched on.
That's the crucial question, absolutely. The administration, working alongside a Senate Republican working group, is pursuing comprehensive reforms. The stated aim is to ensure the CDC is leaner, more focused, and more responsive. The primary goal seems to be to reorganize the CDC's structure and refocus its mission solely on detecting, controlling, combating, and preventing communicable diseases. There's a clear aim here to end what they call bureaucratic duplication and mission creep. The insight is a clear intent to return the CDC to what many conservatives view as its original, perhaps more limited, and maybe more effective mandate.
So, literally going back to basics, to the CDC's original purpose in a way, how would they achieve that kind of structural narrowing?
Well, proposals include transferring health promotion and disease prevention activities, things like chronic disease programs, to a newly created entity, the Administration for a Healthy America, or AHA. Additionally, biomedical research functions, which some sources criticize as a distraction from the core mission, would potentially be transferred to the National Institutes of Health, the NIH. This would significantly narrow the CDC's operational scope, allowing it to concentrate almost exclusively on infectious disease response and surveillance.
And what about improving the agency's ability to respond to future health crises? Are there initiatives to fix the data collection and preparedness issues we saw during COVID?
Yes, that's definitely a key focus. Calls include establishing a real-time national public health data system with sufficient funding addressing a major gap highlighted during past pandemics.
That seems critical.
Absolutely. Additionally, there's a push to restore management of the Strategic National Stockpile, the SNS, back to the CDC. Since 2018, its management had been with another sub-agency, which many sources claim contributed to the COVID-19 supply shortages. So the insight here is a direct effort to learn from past mistakes and bolster the nation's readiness for future emergencies.
Beyond these structural changes, are there any proposals to make the CDC, say, more responsive to political leadership or to expand its international role?
Indeed, on both fronts. The administration aims to increase the number of non-career or political appointees to guide policy, which would centralize political influence within the agency. They are also considering transferring the CDC headquarters from Atlanta to Washington, D.C. The rationale given is for quicker access to federal leadership during emergencies.
Interesting. Moving it closer to the political center.
Exactly. And on the international front, a joint CDC Department of Defense, DoD task force, composed of biowarfare experts, is proposed to monitor global threats. This comes as critics claim the World Health Organization, the WHO, failed during COVID-19, specifically citing instances like initially downplaying human-to-human transmission in January 2020. The insight here suggests a move towards a more unilateral, perhaps more politically guided approach to both domestic and international health strategy.
That covers a broad range of reforms. And finally, you mentioned earlier the MAHA movement's focus on food and pharmaceutical industries. Are there specific food policy initiatives being pursued right now?
Absolutely. The FDA, under Kennedy's leadership at HHS, is set to focus on removing petroleum-based artificial food dyes from the American food supply by 2026. That's a significant regulatory move.
Okay.
Additionally, there's strong support for restricting Supplemental Nutrition Assistance Program, SNAD benefits for processed foods and candy. Already, 4 states, West Virginia, Idaho, Arkansas, and Indiana, have submitted waivers to implement this kind of restriction. The insight here is a clear extension of the MAHA movement's emphasis on diet and its perceived impact on health, translating directly into regulatory and social welfare policy.
It's incredibly clear that the CDC and really America's entire approach to public health is at a profound crossroads right now. We've seen this decisive move to redefine its mission, its leadership, its policy direction, all with the stated goal of restoring trust and effectiveness.
Yes, this era marks a really significant departure from previous public health approaches. The emphasis on re-centralizing the CDC's mission, empowering political appointees, and rigorously scrutinizing vaccine and food policies. It reflects a strong conservative viewpoint on how best to safeguard national health. As these changes unfold, the critical test, I think, will be how they impact the nation's ability to respond to future health challenges, and whether they effectively achieve that stated goal to make America healthy again.
Which leaves us with a final thought for you, the listener. As the CDC undergoes this massive transformation, what will be the true measure of a healthy America in the years to come, and whose definition of health will ultimately prevail?